Hello everyone, this is our Dental Talk Without Secrets, and today we're going to be talking about direct veneers. There are several ways how you can perform a direct veneer with composite resin on a patient, mainly because there are several reasons why you should do it in the first place. Reasons like teeth with altered shape, such as a pegged tooth, short teeth, several reasons where the format of the tooth needs to be improved, such as this one here, where the patient lost the central incisor and then the orthodontist put the lateral on the place of the central, the canine in the place of the lateral, and so on. Then you have to transform those teeth into another thing. Uh, this is not ideal in my point of view, but these are some cases that happens to us sometimes. Of course, there are dark teeth. Dark teeth is probably one of the most challenging situations that we have in our profession. Many students, many people, many dentists ask me, why should you do that with composite resins instead of just preparing the tooth, in this case, just one tooth? This is the challenging thing. Why don't you just prepare it, send it to the lab, and have a ceramic veneer made? Because one ceramic veneer, it's harder to match than one composite. Because if you miss something on the ceramic veneer, you're going to have to do it all over again. Because once it's cemented, you can have some alterations on the value of the tooth, not just the color, but the value. Sometimes the tooth gets a little darker after you polymerize the cement. Sometimes it gets a little lighter, usually darker. And then if it's not good enough, you have to do it all over again. But with composites, if you miss a little bit of the value, a little bit of the shade, you just remove the last layer and then redo it. So sometimes it's easier to do with composite than ceramics, like this case here. And then you have teeth with white spots. This is a very typical indication for composite resin, direct composite resins on a tooth. Like sometimes you don't even have to go through all the surface of the tooth. You have to do just specifically on that spot where you have to do it. But it's almost a full veneer in this case. And then we have the smile makeover, where the patient has several alterations and then you have to make several veneers. This is beginning to be, especially here in Brazil, some kind of a trend. Many people are doing those things. But some cases, this is an indication like this one here. You can see it's a young patient. Young patients, we don't do ceramics ever, especially patients that has just finished the orthodontic treatment, like this case here, because there will be variations on the gingival line in a very short period of time. Sometimes the teeth will move a little bit again, so you will need to do some interventions in a very short period of time. If you do it with ceramics, you have to change everything, as I said before. But with composites, you can do minor adjustments, which is very conservative and is a great indication, especially for young patients. Okay. As you see, there are several different situations that can benefit our patients with direct veneers. As I said before, it's direct veneers with composite resin is being a trend again. It's not first time here in Brazil, but sometimes what we get in our office are things like this. This is a young patient with full veneers, composite veneers, that wasn't needed to, because I saw that patient when she was wearing braces, when she was in orthodontic treatment. And then what you have here is a young patient that will have these composites. She is 18 years old. She's going to have those composites for the rest of her life. And this is not going to last for a long period of time, because as we discussed before in another video here, when we talked about longevity, when you have a lot of materials on the surface of the tooth, the longevity will be smaller, will be less longevity than when you have just small portions of composite, thinner portions of composite, especially composite that don't go all the way over the gingiva of the patient. Okay, so in this case here, the patient will have a big problem through the rest of her young life. Okay, so this is the case we're going to be addressing. This is a case where the patient already has some composites. We're going to be removing those old composites. This is the first thing we're going to do. People who knows me understand that everything that I do under a microscope for the past 23 years. So what you see here is the image that I see when looking through a microscope. Okay, so this is not a camera that is taping what I'm doing, but this is the actual image of what I see while I'm working on the patient. Okay, so let's see how we remove it. Sometimes we don't use the water, sometimes we use the water, but the important thing here is to look and check specifically so that you can remove only the restorative material, preserving the best way you can all the sound tooth structure of the patient. So I want to be the most conservative possible. Of course, we're going to have to do a little bit of a veneer over there. I want to show you something here on the mirror, this image here. You see that on the incisal edge of these teeth, the 4 incisors, you have a very deep a deep groove on those teeth here, and that's going to be restored also. Okay, so I'm removing all the old composite from the patient. Okay, all the composite in a very conservative way, the best conservative that I can be. In this case specifically, I'm using the rubber dam isolation because the patient has a very thin gingival type and it was already bleeding, especially between those 2 central incisors. So I use the rubber dam. I think this is very important sometimes. I don't use it all the times, but whenever is needed, I think we must be used on using I use the 2 words the same, but we must be accustomed to working with a rubber dam. Okay, if you don't know how to do it, just practice. It's not a big deal. Okay, it's not a rocket science. So in this case here, not in this case, but usually I do the 2 central first, and then I do the laterals, and then if needed the canines. Okay, so I'm gonna do the 2 central first. I already removed the composites from the laterals, but I'm going to do only the 2 central first. Some people do all the teeth at the same time. I don't like to do that. Some people do just one tooth first, the whole tooth, and then the other one. But I think it's important to do both centrals so that you can observe how they can be very symmetrical. Okay, so let's go. Acid conditioning, total acid conditioning. Here, making sure the whole surface of the tooth, the teeth, both tooth here, they are very well conditioned for the proper amount of time. And then I can, when I dry the surface of the enamel, not the dentin, but the enamel, I can check again if there is any old composite over there. If there is, I remove it and condition again. Okay, now I'm gonna use a universal adhesive. As you can see here, very thoroughly. I evaporate the solvent, very important step. Polymerize the composite, and then I'm going to use the BeautyFill system, BeautyFill 2 LS, which is low shrinkage from Shofu. The system has 2 opaque composites, the A2 opaque and the A3 opaque. In this case here, I'm going to use the A2 opaque, and I'm going to start. Remember that we have not just that groove on the incisal edge, but we have a cavity that was supposed to be the class 4 of those teeth. So I'm going to fill in those cavities with this composite here. Okay, so I'm filling those 2 those 2 cavities first. And after that, I'm going to use a silicone matrix that I made from a waxing on a model from from a previous appointment that I did on that patient. Okay, so in the previous appointment, actually the first appointment of the patient, I took an impression. I could have scanned the patient, doesn't matter, and then I did a wax on, and then I made a palatal matrix with a silicone. Okay, so that's, and then after that I'm going to use the Beautiful LS incisal shade, which is a very translucent shade. I'm going to use it on the matrix, and then I'm placing the matrix on the palatal surface of those teeth. Okay, it's going to be a very thin layer. Okay, about 0.5 millimeter thick. That's what I'm doing. And then after polymerizing, I remove, you see here, I remove the matrix, and then I'm going to start again to use the opaque composite, okay, the A2 opaque. This is a mylar stripe that I put over there just to make sure I have the right contour of that layer. And this layer, of course, it's going to be thicker on that area where I have the class 4, but after that I'm gonna pull a little bit of the layer onto the tooth, probably on the whole surface of the tooth. Okay, very thin layer, very thin. It's going to be thick on the area where the class 4 was, but then I will bring a very thin layer over the whole surface of the tooth, getting very close, about 2-3 millimeters away from the gum line. So this is the opaque composite. I'm going to do it on both teeth. Polymerize it. Did the other tooth the same thing. Okay, and now I place the mylar stripe again, and I'm going to do just the mesial surface of that tooth. Okay, so I put a little bit of the which would be the chromatic enamel, so the Beautiful LS B1. Okay, I'm going to put it on the mesial surface, and then I'm going to bring that mylar stripe from the buccal surface to the lingual surface, to the palatal surface. Okay, so that I can have a nice contour on that mesial surface. You see, I'm going to do that on the right central and then on the left central. That's what I did. And now I'm going to use a little bit of tint. This is in Portuguese, I'm sorry about that. That's a white tint, a little bit of white tint on the incisal edge. And then again, the Beautiful B1, the chromatic enamel on the whole surface of the tooth. Okay, I have to be very careful on the gingival area so that the composite over there is very thin. Okay, I want it very thin. I don't want a whole bunch of composite pressing the gum line. No, I need a very thin layer of composite on that area. Okay, and then as I remove the excess towards the incisal edge, I'll be, even though here this is a, let's say, an enamel layer, I'm going to draw a little bit of mamelons. Mamelons usually we do it on dentin, but in this case here, I'm doing those very subtle design of the mamelons on this layer of composite. Okay, and after that, I'm going to fill in those spaces with an achromatic enamel. Okay, with a more translucent enamel. Okay, so this is the B1. I'm removing the excess. You see, refining the mamelons, and now I'm going to use the enamel shade, high value enamel shade on both teeth. That's it. Okay, after doing that, I remove the rubber dam. I'll do my finishing and polishing using the whole system from Shofu. As you can see here, the Super Snap, some of the rubber points that they have, which is also very good. This is some multi-blade burrs that I use to do some anatomy. Okay, you see here, I'm using the one gloss from Shofu, two different shapes. Okay, one gloss, and then some stripes, interproximal stripes, This is the Campo Master to refine a little bit the shade, and I'm going to finish it with a paste, okay? A felt disc, a paste, and a dental floss interproximally. Okay, that's a felt from Shofu, and this is the final result. This is it. Okay, I also added a little bit of composite on the incisal edges of the canines. Okay, so this is bottom line of everything I used in this case. Okay, chromatic enamel, Beautyfill LS B1, enamel shade HVT, which is high value translucent, white tint, palatal, in the palatal shell, which we call that layer that we did over the matrix. I used the incisal shade, and then as an opaque dentin, I used the A2 opaque. Shofu has what they call gyromer technology on their materials. So gyromer technology is a bioactive surface pre-reacted glass filler that has the capability of releasing 6 different ions on the interface between the tooth and the composite. Okay, so it releases and recharges with fluoride, which is the most important ion in this case here, but not just the fluoride. It also releases strontium, borate, aluminum, silicate, and sodium ions. And all this technology brings many benefits to the patient, especially for the young patients, for the elder patients, patients which has a more tendency of having more caries. So, as I said before, this gyromer technology has a continuous fluoride release and recharge, a decreased acid production of carcinogenic bacteria. It forms an acid-resistant layer on the surface of the tooth, on the interface between the composite and the tooth. Has an anti-plaque effect on the surface of the composite and reduces the solubility of the tooth. Okay, so it's a very nice technology that brings an additional benefit to the composite. Okay, it's what they call a bioactive composite. I like it very much. So this is the final restoration. You can see the very subtle effect on the incisal edges of the centrals and laterals. I also did a little bit of composite on the incisal edge of the canines just to create a little bit of more volume on the incisal third of the canines. So here you can see the before and the after. Very subtle, not too bright, because the patient didn't want a very white teeth. The patient wants, actually most patients today, they want a natural look, a natural composite on their teeth, a natural effect composite on their teeth. Okay, so this is the case before and after. And as I told you, this is you can see here that the composite doesn't go all the way to the gum line. It finishes a little bit before the gum line, so you won't have anything making a pressure on that gingiva, so the gingiva will be always healthy. Okay, this is one way of doing composite resins. Okay, this is how we did it. Those are the materials we use it, but of course there are other ways of doing it. There are other materials, other techniques, other strategies where you can use composites on the tooth. But that's something that we'll be discussing on another time. Okay? Thanks for watching. Hope you enjoyed it.